Dr. Ayensu. How are you?
Good morning. How are you? I'm fine.
Thank you for joining us. Did I pronounce your name correctly, Ayensu?
Yes, that's great. Addo-Ayensu, that's great.
Addo-Ayensu, okay.
Oh, Dr. Gloria.
Gloria, got that. Or Dr. Gloria works very well, doesn't it?
That's what everybody does because it is a mouthful. And so Dr. Gloria is great as well.
Oh, thank you. It's certainly very personal and personable. I appreciate you taking time on a Saturday, but the interest is very high.
Of course.
People want to understand the process and how they can access it, and they are willing to wait their turn as long as they believe, understand that their turn's going to come. And so we're trying to lower the anxiety and information always helps.
Yes, yes. And these are stressful times. It's gone on for a while, It's not like we've just entered this pandemic. We've endured it for over a year. Our health department has stood up its incident management team since January 21st. And a lot has happened. And people are tired, people are tired.
Yeah.
People are a bit tired and are looking for relief. And so having a solution that is not available in sufficient quantities.
Very nerve-wracking, yes.
Yeah, can be a little overwhelming.
Mm-hmm. Yeah. I think I'm going to wait till Delegate Murphy, are you on?
I am, but it says that my host has stopped my video. Okay. I push video, it says you cannot start because the host has stopped it.
Oh, okay. Interesting.
Actually,
I'm not the host. My technology person's the host. So at exactly 10 o'clock, we'll start everybody's video. Is that okay?
Yeah, it's fine with me. By the way, Dr. Gloria, I just found out that Safeway in DC, the pharmacies in Safeway are giving shots. Are our Safeways in Virginia doing that as well?
No, and it depends. So it could be that DC has engaged their pharmacies for a while now, several weeks now, in actually doing their vaccinations for them. So you register with DC, and DC gives your name to to pharmacy, to the Safeway, and you go get it over there. Just like we are also working with, for example, so this week we've worked with George Mason University. They have vaccinated close to about 1,000 people for us.
Wow.
We just took people off of our rosters and gave it to them in order, because we're trying to move the queue in order. We have had conversations.
My sister's friend got a call from his Safeway pharmacy, and they said we have 8 leftover vaccinations that have to be given. Can you get down here in less than 10 minutes?
Yes. So that's, we try not to waste vaccines in our clinics. We do the same, but it is quite limited because we have these mass vaccination clinics, and at a certain point in time, the vaccinators are not allowed to open a new vaccine vial. They start sharing, so that by the time we get to the end of the clinic, there's very little left. It's hard to do that in a safe way when you're probably just one vaccinator or 2 at best.
Yeah.
So I can see how they'd have more vaccines available at the end of the clinic day.
Okay, ladies, I'm going to officially open this. It's 10 o'clock. So we're going to go for 1 hour. Both Delegate Murphy and I advertised this Zoom meeting robustly among our constituents. So I expect we're going to have a lot of questions.
And I'm pretty sure that Dr. Gloria will be the one who will have to answer almost every one.
Yes,
So
yes.
we're
Well,
counting on you.
and Dr. Avula, who is Governor Northam's appointed vaccine program guru, will also be joining us. So we'll have a state perspective as well, but the boots on the ground is really where the vaccines are going to be administered. So yes, Dr. Gloria, I think you'll be the star of our show. Let me just start by asking two of the most frequently asked questions that lawmakers are getting. Lawmakers have advised constituents to sign up through different websites and different registration forms. So the question that folks have seems to be, when will I be contacted? Will I get an appointment when my turn comes up? And how exactly are these websites being managed? Because people don't want to get lost in the shuffle. They're happy to do the right thing, but they don't want to get lost in the shuffle.
So that's a good question, and thank you for the opportunity to participate in this forum this morning. If I can start by saying that currently the health department is offering vaccination registration to adults 65 and older, healthcare personnel, and people with underlying medical conditions. And then also through special clinics, we are working with community partners to administer vaccine to people living in correctional facilities, homeless shelters, and also having other arrangements for frontline essential workers and people in childcare and teachers and so on. When it comes to the non-occupational groups in 1A and 1B, eligible individuals can register online through our website. People who need assistance with registration, or people who need to register in another language, or people who do not have proper internet access or technology for online registering, can contact our call center to register over the phone. And that number to call is 703-324-7404. 703-324-7404. The health department's vaccine hotline hours are Monday through Friday from 9 a.m. to 7 p.m. and then on Saturday and Sunday from 9:30 a.m. to 5 p.m. So the registration process collects basic information so we can confirm your eligibility and then add you to the appointment queue. Currently, we have over 160,000 people who have registered and are in that queue. Our registration process, although it started off with some bumps in the road, is now going pretty well. Those who registered after January 18th are receiving communication within 24 hours to let them know that they have successfully filled out their questionnaire, their online questionnaire. If you provided an email or a cell phone or your home phone number, you will get confirmation through all three avenues. You'll get a text, you'll get an email, and you get a phone call to let you know that you've successfully registered. Then the next communication that you receive will be an invitation to schedule an appointment. So for those who have submitted their information online, the health department will contact you via email to schedule an appointment. If you completed registration on the phone, then you will receive a phone call to schedule your appointment. And so, we're asking that people be patient with us and to rest assured that their registration is in queue. The health department will contact you to schedule an appointment as vaccine supply and appointments become available. So that's the process for getting your first shot.
One of the comments I have received from constituents, and I think Delegate Murphy's received the same comment. People are very anxious about waiting the 3 or 4 weeks. Can there be some interim communication so folks know they're still in the queue, they haven't been forgotten? It's just a question that the supply hasn't quite met the demand. This is an understatement. So I asked the same question to the Arlington, to Dr. Varghese.
We're actually working on that.
Okay.
We actually met this week, a few days ago, and we are looking at how we can provide interim, interim updates for people to know that we haven't forgotten about them.
That would be wonderful. Okay, I will ask my co-host, Delegate Murphy, if she has any questions she wants to put into the queue.
No, I just think people need to know, they call into a number and they leave their name and they leave their information, and they're looking for some kind of confirmation that they've been heard. They are feeling a little lost, and I don't blame them. I got a shot my vaccination the other day. I got a call from the hospital, and they told me to come over. But I don't think that people have enough information. And I think that it's really important that they know that they've been heard, that they are registered, that there will be some time before they're hurt, they get called in, but they want some kind of confirmation that they've been heard. And that is hard to get on these phone where you leave your name and your information online or on the phone. It's just not reassuring.
Yes, they do get one confirmation from us to let them know that whatever they did online has been successful. But it's that long wait where they are in queue and are not hearing from us. And that anxiety is also exacerbated by when they hear that there's limited supply. So it makes you think, oh, maybe I haven't heard from them because they run out of vaccine or whatever. That is not the case. It's just that, as I said, we have over 160,000 people in queue, and that number continues to grow. And the vaccine supplies are limited. Virginia is receiving about 105,000 doses a week, and they're using a per capita formula to divvy up that vaccine to the local health district. And so for us, we are receiving 13,600 doses a week.
But I think too that people are concerned after they have the first shot that maybe there won't be enough there for their second shot. And then is that even a possibility?
Well, right now, people, the 105,000 doses that come to Virginia, which is then delivered to us, 13,600 is for first doses. The Virginia Department of Health is keeping track of how many first doses have been given. And we don't have to request for second doses. They've been coming automatically
I see.
Based on the vaccine. So when you receive your vaccine, you'll be given a card that tells you which vaccine you got and when the second dose is due. It's either going to be 21 days or 28 days after your first dose, depending on the vaccine that you got. As you know, the vaccines are not interchangeable. And
right.
Yes, so if you got a Moderna vaccine, then you'll be getting it 28 days later. If you got a Pfizer vaccine the first time, then you'll be getting the second shot 21 days after. After you get that, you've gotten your vaccine the first time and gotten that card, we put the name of the vaccine on there so that people do not forget. You will then get an email invitation with a link to schedule your second dose during an appropriate window based on the date you received your first dose. So typically, people can expect to receive this notification at least 4 to 7 days before the dose, that second dose is due. And again, we ask that people don't, you don't need to contact the health department to schedule that second dose. And again, you will not be asked to complete another registration form. It will all happen automatically. And we hope that people will trust that we will call them.
Thank you, Dr. Gloria. I just had a request. Please formally introduce yourself and give us your title, because you're speaking with such knowledge and confidence. So,
hello, everyone. I'm Gloria Addo-Ayensu, and I'm the Director of Health for Fairfax County.
Thank you. We appreciate your hard work and your leadership in these challenging times. And we do know that our healthcare professionals, especially those in the public health arena, are working extraordinarily hard and long hours just to manage the distribution based on the CDC guidelines of our priority lists. We are getting some questions about folks who may be 70 years of age or older. Have we been able to complete our 1A list and we're moving to 1B? And where would the 70-year-olds be? Are they coming up in the queue?
So yes, we are vaccinating all groups, 1A and 1B, at the same time. So for 1B, we are only vaccinating the K through 12, the childcare, the frontline essential workers and public safety, corrections, and homeless shelters. So they're all part of our current efforts we adhering to the governor's recent guidelines that is asking that we dedicate 50% of the allocations that come to us weekly to our older adults, and then the other half to the occupational groups, as well as those with underlying medical conditions. And that's what we are adhering to. So we have a mix of people. The vast majority of those who are in our queue are the people with underlying medical conditions, followed, and then the next large group are people with who are 65 plus, and then we have a few stragglers in the 1A category. So as you can imagine, not everyone in each of these priority groups is warming up to the vaccine at the same time. So for 1A, we still have people in 1A because it's been a few months, or it's been about a month or so, a few weeks. Their friends or their colleagues have gotten the vaccine. They've lived to talk about it and to tell them their experience, and they're feeling more comfortable with the vaccine, and therefore they are now registering to receive their vaccine. So as I said, it's just first come, first serve, and we're not looking through our queue to see who is 1A and to move them ahead. No, it's exactly on a first come, first serve basis. And
I'm going to ask one more question, and then I'll introduce Dr. Danny Avula. Thank you, Dr. Avula, for joining us. Dr. Gloria, which we so lovingly call you in Fairfax, there's a gentleman in our chat over the age of 65, registered for the vaccine before January 18th, and is wondering where he will be in the queue. Should he be waiting 3 or 4 more weeks, or is he right around the corner?
January 18th. So prior to January 18th, if I have my math right, so he's 65 plus, right?
Yes, that's correct.
65. So I know that, prior to us expanding the priority group to include 65 and above, we had about 60,000 people, 70 plus, already in the queue.
Okay.
And I believe that expansion happened on, maybe January 16th or January 18th, around that time. So again, depending on
Depending on supply, and you already had 60,000 plus who are 70 years of age or older. So at the rate we're going, if you're only distributing 13,000 vaccines a week, unless the supply considerably increases, goodness, he could be waiting for 4 or 5 weeks.
Yeah, it is going to take some time. And as I said, we are also hosting special clinics for the for the occupational groups within 1B as well. And that is not, those people are not part of
teachers,
the
yes.
wait list.
And those
Teachers and
are really, they're folks who work in Fairfax, may not necessarily live here, but they are in those identified high-risk groups. Police, fire, emergency,
right.
That's correct.
fairness, yeah. And then, of course, teachers. I am going to ask Dr. Avula to officially join us, and thank you for your leadership and guidance with the state program. You are the state's COVID vaccine guru. So tell us everything you can possibly tell.
Well, thanks,
Put
Senator
it at
Favola.
ease.
Yeah, happy to be here with you all this morning. And just maybe one quick caveat. I have only been in that role for 3 weeks. Prior to that, have been one of Gloria's colleagues.
So you have all the answers. You've been there 3 weeks now.
That's true, right, Delegate? Well, let me maybe just kind of give a snapshot of where we're at today. And I'm sure Dr. Gloria covered a lot of kind of what's going on in Fairfax and the process. And I don't know how much sort of bigger picture state stuff she touched on. But, as of this morning, we're at 758,000 doses delivered. And so that number has just continued to skyrocket. We went up by about 60,000 doses in between yesterday and today. And that is a combination of a couple of things. One, more vaccination is happening. We're finding ways to manage our inventory differently. We've asked a number of health systems to use some of the inventory that they've been holding on to, their second dose inventory, and to use those as first doses this week. We also have continued to find places where the data feeds aren't linked. We onboarded a team about a week and a half ago to go and find all of the providers who have been providing vaccine and make sure that their data systems are talking to our data systems. And I think, a week ago, the numbers did not look good. We were, by a particular metric, the percentage of doses administered over the total number of doses that Virginia had received, we were 50th in the country. And I think all of us were scratching our heads saying, this is not what's going on in Virginia, because clearly our health systems are doing a fantastic job. Our health departments are doing a fantastic job of getting doses out, but it's not registering. And so we really have tightened up where those doses are going. We've gotten clarity on where our inventory is. And now, as of yesterday, at least, we were at 21st. And there'll be a little bit of bouncing around, but the reality is that the capacity exists across the state to do vaccination at a really high scale. I think, look at Dr. Gloria's efforts, they can do 3,000-4,000 plus people a day. And so there's no doubt that the capacity to get vaccination out at scale is there. The challenge that we have moving forward is the amount of vaccine coming in. So up until this week, it's been about 105,000 new doses a week. We just received word yesterday. The White House said a couple days ago, we're going to get increased allocations by about 16%. And that does appear to be the case. When we looked at our allocation yesterday, there were about 18,000 total doses increased. So that's encouraging. It's still nowhere near where we need to be. It's nowhere near the demand that currently exists. And so our kind of core message to the people of Virginia is that everybody who wants to get vaccinated will be able to get vaccinated, but it is going to take several weeks as we employ this parallel effort to make sure we're prioritizing our 65 and up population, but then also systematically working through those essential worker tiers and 1B. And so folks who are in that 1B category who are saying, I'm eligible, why can't I get vaccinated? Just know that we want to make sure that our most vulnerable are at the front of the line, and that it will likely be a couple of months before we work through those tiers. And I know that's a frustrating message, but it's the reality of
It's the reality.
yeah. So
Yeah, we just, hopefully President Biden will invoke the Defense Production Act and we can really pump some money into the production of these vaccines. And I think the distribution to the states seems to be working, but you're just not getting enough.
that's right.
And that's the problem. There's a question in the queue. Individual says, I'm an 88-year-old. She had an appointment with Virginia Hospital Center. Virginia Hospital Center had to cancel the appointment. Will she lose her place in line? My understanding was the health systems were Virginia Hospital Center and Inova, that those patients where the appointment was canceled would be integrated sort of where they are in their current status into either Fairfax or Arlington or Loudoun, wherever they happen to live. Is that a fair assessment?
So what we are asking individuals to do is to register online. In terms of Inova, I think Inova's statement was that they would, as vaccine becomes available, that they would be looking at the people who had been registered. It doesn't seem that that is the case for Virginia Hospital Center. At least their email or the message that they put out did not extend that possibility. So what we are saying in Fairfax is that people can now, register to join our queue.
It was a very abrupt message and gave a lot of people concern. And I know that Dr. Varghese, on the conversation we had with him just a few days ago, he said that those who did have appointments at Virginia Hospital Center and those appointments were canceled, they would be integrated into the Arlington queue. But I would make sure, if I were a patient at Virginia Hospital Center, to register in the Arlington queue as well. I know Dr. Avula, go ahead.
I'm not sure if they will be. Did he indicate that they would be doing Fairfax County residents in that queue?
He had said those who had had an appointment at Virginia Hospital Center. We
Okay.
didn't tickle down if they happened to be Arlington or Fairfax. You may want to have a conversation with them.
Because that was not my understanding. I would ask the individual who asked the question on the chat to please call me as well at 703-246-2479.
2479. Julia, maybe you can get that into the chat. 703-246-2479. Okay. Let's see if we have any other questions that have not come up.
Question, Barbara. How is it that people will be assigned to CVS or Safeway pharmacy and those places to get these shots?
Yeah, so right now, CVS and Walgreens are really only delivering vaccine to nursing homes and assisted living facilities. They've been contracted separately by the federal government to handle that priority population. At some point in the middle of February, there will be a new pathway for a federal allocation of vaccine to come to a few different pharmacies in the state, and then they will have their own registration process. I am not 100% sure on how that's going to roll out. I mean, I think that it's happening through a different channel that the state is not controlling. But what will happen as we have more and more providers, so that's a specific to pharmacies, but as we have more providers, there will be an element of registration that happens through this PrepMod platform that health departments are now adopting. And for those We were given a registration platform called VAMS. It was problematic in many ways, and I think has added to a lot of the frustration, certainly for us, and even more importantly for the people who are trying to interact with it. And so we have had to shift gears and to use a product that will provide better service and better clarity about how to actually get signed up for a vaccination appointment. But so that will be, it's phase 1 rolled out this past week. We'll complete that in all health departments over the next 2 weeks. And when we have appointments that open up in different places, not just health department clinics, we'll be able to use PrepMod centrally to do that. Now, the overlay of how that happens at the state level and the local level, we still need to ensure good integration, because we don't want to step into Dr. Gloria's operation and mess up the systems that she's already created. And so, but there are some districts that just don't have the resources or the capacity that Fairfax does. And so a centralized system is going to work better for them. So our work this week is to make sure that those dots are connected and that we're not complicating things for the local operation, but that we're also creating a pathway and an additional capacity. Because, like, you know, in so many districts across the state, people are calling, they're online for hours, they can't get through. And so at least there's one central place where you know someone will answer the phone and help you get an answer and help you get, if not an appointment, at least in the queue for one.
Dr. Avula, a question came in. Are there any prospects for the Fairfax Health Department to receive additional vaccine doses above what their sort of population-based allocation would be if they're doing an incredibly good job at getting the vaccines out? And in other words, will they be rewarded for?
Yeah. Unfortunately, no. You know, I think that happened to some degree in the early goings of distribution, where a lot of the vaccine went primarily to health systems. They were the places where many of our 1A population work. But on a purely logistical level, they were also the places that had the ability to do cold storage, right? So the Pfizer vaccine requires negative 90-degree storage. Really only hospitals and then a few health departments had the capacity to do that. So they got a bulk of the vaccine at the front end of this. And now our vaccine supply is so short, and the capacity exists all over the state. And so there won't be a prioritization for people who can get it out faster, because everyone, frankly, at this point can get it out.
Okay. All right. That's a good question. It came in from one of our listeners. I guess one of the other things that has come up rather regularly, and I don't know who I should address this question to, but if individuals register on one site, some of them get anxious and they want to shop around and register on multiple sites. And my understanding is we'd want to discourage that. Is that a fair perception?
So what I'd say to that is, if you just remember to come back and cancel your appointment or cancel your registration when you get your appointment through another site. So, you know, if there's another hospital system or some other avenue that allows you to register for an appointment to get a vaccine, once you get called for that appointment, we would appreciate it if you could come back into our system and take your name off of the list.
Okay, that's very good. That was helpful information. Dr. Gloria and I would say Dr. Avula. Dr. Gloria gave me permission to call her Dr. Gloria.
Yes.
That's what she goes by in Fairfax.
Yes.
We all love her and know her. So we're very interested in the social equity piece, and we do have neighborhoods that are underserved, folks that don't have access to the internet, folks that are not following the news, would not necessarily think about how to register. How are we reaching those folks, and are we able to track the vaccines that we're getting into the arms of folks who would be in those underserved areas?
So what we have done, even before vaccine arrived, has been to work with our ethnic minority groups. We have a multicultural advisory council. We have an outreach team in Fairfax County that engages with ethnic minority populations. And, you know, part of the vaccine distribution will include private doctors. But for them to receive it, there had to be some paperwork that they had to submit an application to actually be able to administer vaccine. So we worked with our Multicultural Advisory Council. Well, we worked with all providers to ensure that they knew of this, you know, application process, and to ensure that they actually applied. But we did special outreach through our Multicultural Advisory Council to identify physicians that the ethnic minority populations in Fairfax County seek care from. There were about 70 or so names that we got, and we worked with them. We've had a number of town hall meetings with them to help them through the application process and to actually get them ready for vaccine distribution. Unfortunately, we don't have enough vaccine, and so and not all of them have their applications completed. And so we're still working with them right now for them to help us address vaccine hesitancy issues, to get people to talk about the vaccines, to clarify any myths out there that are circulating, and there are many of them. And then with the hopes that when they do get vaccine, that they will be able to administer it. We are encouraging people through these networks to come and register through our online system. As I said earlier, for people who don't have, you know, online capabilities, there's also the phone system, and these communities are being provided with both alternatives. Our goal and our desire will be that there'll be a time when vaccine will go to them in their communities through the doctors that they trust. Survey after survey shows that people trust their doctors. People have questions, and you know, they don't know us at the health department. All they do is to register and get in line and get a shot in their arm. They don't have the opportunity to dialogue with us like you would in your doctor's office before you got a shot in your arm. And so that's our preferable route, and we're hoping that soon we'll be able to utilize that avenue as well.
I hope so, because so many folks don't have a medical home, and it'll be a challenge. So I'm glad you're putting some thought, and I'm sure some resources into helping our underserved areas. Go ahead.
One thing I forgot to mention is our FQHCs. We're working with neighborhood
the federally qualified health
Yes,
centers.
we're working with neighborhood health and health works. Some of the allocations that we get, we give to them because they're already seeing these patients. They've gone through the application process, all the training to be able to deliver vaccines. So they're very much a partner at this point.
That's great. So glad to hear that. Dr. Avula, this is another question that came up. We discussed this on our Arlington call, but I'll let you answer this once again. Individuals are continuing to wonder why their appointments were canceled at Virginia Hospital Center and Inova, especially at the last minute. So I think I know what you're going to say, but I am going to give you the opportunity
Sure.
to say that.
Yeah, I'll just first say that I realize how incredibly frustrating that must have been for so many people who got those cancellations, who were looking forward to their appointments. You know, for the first 3 weeks of this, as I said, the hospitals got the bulk of the vaccine. And I think what that meant, or what that created, was an expectation for the hospitals that they would continue to get that volume of vaccine. We went very quickly from 3 weeks of dispersing almost all of the vaccine to the hospitals to all of a sudden there being way more capacity across the state. And so hospitals that had made appointments a week or even 2 weeks out, all of a sudden are saying, okay, now with a pie of 105,000 doses that has to be spread over the entire state, they're not going to get what they asked for. And so, that first week of January, we did the allocations late one night. We realized, okay, there's not enough to go around. Everybody's getting less than they know. And so basically in a 24-hour period, those hospitals had to course correct, which meant to a lot of appointment cancellations. So obviously the partner health departments are doing what they can to fill in the gap and to prioritize those folks who had appointments, ensuring they're in one of the 65 and up or other 1B populations.
Well, yeah, that was an unfortunate but very quick sort of a correction in the course, I guess is what we would say. And but it did cause a lot of heartache. So let's hope our health departments can do their very best to integrate those who had appointments at these hospitals into the queue.
Several people have asked if there is a cost to getting this vaccine.
Good question. Good question. I had that on my list.
There is no cost. The federal government has funded the vaccine for the entire country. There are certain cases where a provider will charge for insured patients, will charge an administration fee for the time of organizing and actually giving the vaccine. But for uninsured patients, there is no out-of-patient cost, and there's a different pathway for those providers to recoup some of that money.
Thank you.
So cost is not a barrier here. Please understand that, and accessing the vaccine is really a public health goal, and it's a goal for your personal health as well. Let's go on. A panelist said, coming from my internet coordinator here, I registered my father online, but the confirmation email just says his appointment is pending approval. So should he go on his scheduled appointment date or not? He was confused. They're confused by the response pending approval.
So they, if I can recap, so they registered, and then we reached out to them and gave them an opportunity to make an appointment. Correct. And they did. They chose a date, and now they're saying the appointment is
pending approval.
That must have been an error in the message. Again, if I can either have that individual's number, or if they can reach me at the number that I gave, we'll be happy to look into it. If I knew the name,
is that 703-246-2479?
That's correct.
Okay, I did put that in the chat. Okay, let's see. Will vaccines be canceled on Monday because of the snow?
So we are not sure. Actually, we have a vaccination clinic on Sunday. We have a mass vaccination clinic at the government center for second dose vaccines. We are getting ready to have a meeting with the weather NWA, and our emergency management folks, and we'll be making a decision about Sunday and Monday. The thing about Monday is that we don't have a lot of we don't operate in our district offices on Monday. So the vaccination clinics that we have are special vaccination clinics. So it won't impact as many people, but we hope Tuesday is clear and Wednesday and so forth, so we can actually honor those vaccinations, those appointments that have been made.
Dr. Gloria, a question came in. When an individual gets an appointment, the location where the individual must go to get the vaccine will be noted on the appointment notification?
That's correct. So there is a choice. You know, you will know, you'll be selecting where you want to go get the vaccine.
Okay. And
the time where you want to go get the vaccine. So, and we try to maximize how many people we try to maximize the capacity of each vaccination site for that day. So we we don't open it fully, and let's say on Tuesday you receive an opportunity to get a vaccine. It might not include a Saturday because we want to maximize the Tuesday through Friday clinics. And then on Thursday, for example, we open it up to include, the Thursday, the Friday, and the Saturday, and so on and so forth. But it is a person's choice as to where they want to go and what time that they receive it.
Can they register? Can they register at a hospital or a pharmacy for these shots other than with Fairfax County?
No, not at this time.
Mm.
The only people who are being vaccinated on our behalf by Innova are the school teachers, the K through 12 teachers, and the child care providers.
But they are registering through your system.
No, it's a separate registration system.
Okay.
So 160,000 plus that I talked about are strictly people 65 and older, people with underlying medical conditions. And so those are the two groups that are currently being vaccinated through our registration system.
At the moment, are you accepting other registrations, or you're going to wait until those folks are served, then your registration system will open up to the next category of people?
Absolutely.
And the Innova is a separate registration for certain categories of people.
That's correct. So right now we are concentrating on those age groups and the people with underlying medical conditions, as well as those occupations that I talked about. And we are far from over, and so we want to draw down a bit on those groups, existing groups. It doesn't really make sense to keep opening it up and having a waiting line of 300,000 or whatever it is. It's just too frustrating for people.
Yes.
So
yes.
we want to draw down these numbers a bit, and then we will move to the next level.
That makes perfect sense.
And then also we actually move to the next levels in concert with the rest of the state as well.
Okay. Another question, Dr. Gloria. Okay, individual says a friend of hers is over 75. This person cannot get an appointment because the appointment slots are always taken. Are we going to be creating more appointment slots, or is this again just a question of, is it the lack of capacity on the part of Fairfax County or the lack of vaccines?
No, when appointments are given to, or when people are invited to choose an appointment, hopefully we're not sending people an invitation for which there are no appointments. If that is the case, then that is an error. You're supposed to have a choice. It might not be a huge, a wide variety of choices, but we typically have, let's say we have 2,000 slots that we want to fill. We'll send it to, let's say, 3,000 people, and it's being monitored. A few hours later, it's monitored to see how many slots are taken. If nothing has really, not many people have taken an appointment, they wait a bit to see the uptake, and then they open it up again because we want to hurry up and fill these slots. And so if you don't fill, if you don't, take a slot because you either didn't see your email or whatever, you'll be part of the next groupings, for the next few groupings of invitations that go out until you actually select an appointment. So but it doesn't make sense for someone to receive an appointment with slots that says that the times are filled.
You may want to check on that just to make sure things are working as smoothly as you believe they are. That
again, if I may ask that individual to please call me at that number again, I'd be very happy. Or you can send me email. That might even be better. So my email is gloria.addo-ayensu.
There you got, and I've got that.
I hope you can, if you go
All-
online, you might,
All one word?
all one word.
Ayensu, I
Yes.
got,
And
gotcha.
it has the hyphen in there. So gloria.addo-ayensu@fairfaxcounty.gov. If you send me email today or whenever, I'll be happy to talk to you and to find out and to help troubleshoot so we can ease your concerns.
So at the end of the day, if there are extra vaccinations available and they're the Pfizer kind that need to be used, what's the process for calling people and getting them over before their efficacy runs out?
So as we've been doing this for a while, our team has really gotten good at preventing vaccine wastage. And what happens is that, so let's say we have on a typical Saturday, for example, we may have 70 or more vaccinators. So each vaccinator, from the morning, we start at 8 a.m. They run out of, their doses in one vial. They take a new vial and so on and so forth. After a certain time in the day, vaccinators are no longer allowed to just take up a new vial when they run out. They begin to share, and there's people in each vaccination room that monitor this and enable people to share the vials, so that as we get to the end of the day, where we know we have fewer and fewer vaccine people coming through, there aren't a lot of open vials at the end. And you'll be surprised, for vaccination clinics that typically serve 3,400 or whatever people, it comes down to about 3 or so doses. And how we've distributed that is we have people that we have put, that we actually have put on a list. Some of them they typically are, what do you call them? Volunteers, people who are volunteering with us. And so if they are working that day, we pull a few volunteers in and we vaccinate them to the tune of just how many doses are left.
Good to know.
It's excellent. Dr. Avula, is there something that you would like to add in terms of a public health announcement, or what you would, I know there's there are news reports out there saying there are different variants now of COVID-19. There are different strands. Will the vaccines, the Moderna vaccine and the Pfizer vaccine, will they protect against everything that's out there?
Sure. So yesterday we confirmed our second confirmed case of the B.1.1.7 variant. That is the strain that has now become the predominant strain in the United Kingdom. It's been about 13% of the cases in Denmark, and we've seen it pop up in different parts of the world. The CDC actually does anticipate, some of their modeling shows that this may become the dominant strain here in the United States by March. Now, what we know at this point is that it is more contagious. It does seem to spread more easily than the original strain of COVID. But we are still trying to learn whether it's actually causing any more severe disease. We didn't think so at first. There were new reports out of the United Kingdom just a couple days ago saying that in the elderly population, there may be some more severity or a slightly higher rate of hospitalization. So we're going to continue to watch that data and vet the studies we're seeing. It's very small numbers, and so I don't think there's any certainty at all about whether it's more severe. But as we've learned with everything with COVID along the way, we learn as we go, and we're constantly being presented with new information and making new recommendations as a result of that. There are a few other strains that are circulating throughout the world. B1351 is the South Africa strain. We have not yet seen that here in the United States. We are doing active genomic surveillance. About 10%, be somewhere between 10 and 12% of all of the positives that come through the state lab are being genetically sequenced. So we're looking for those strains. And then the CDC has also contracted with different private pharmacies and other providers across the country so that we've got a wide net. You know, it's never enough. We're not sequencing every single case that comes through, but we are actively looking for it, and that's how this second case was confirmed here. At this point, we do still strongly feel that the vaccine is protective against these new strains. We have not seen anything that would tell us otherwise, but we'll continue to watch and make sure that we get that information out to the public if it were to change.
How long after people get these vaccines does their immunity start? Is it immediate?
Yeah, so it starts to build immediately after first dose. So after a couple of weeks of the first dose, we anticipate that you have somewhere between 60 and 70% protection. You get that booster dose at 3 weeks for Pfizer or 4 weeks for Moderna, and then about a couple of weeks after that, so 2 weeks after your booster dose, that's when we think you have about 95% protection. So it happens rapidly. I mean, it starts working immediately. Your immune system responds as soon as it's presented with that protein. But it does take a few weeks from the time of administration to the second dose, and then 2 weeks after that to really be fully protected.
Thank you.
For panelists who asked if you can view this program, you can. We're live streaming this, I believe, on Facebook, and there will be a YouTube video. So and both Delegate Murphy and myself will have the YouTube video posted. So you will be able to view this or share it with others who may be interested in this information. Question from a panelist, not a panelist, I'm sorry, a listener. I heard that the vaccinators were told to take 5 doses from each vial, but it turned out 6 or 7 full doses could be obtained from each vial. Is this correct? If so, could county vaccinators be more efficient?
Yeah, there has been a little bit of variation based on how much is in each vial and the needles that are being used. But what we're seeing pretty consistently is that with the Pfizer vials, which are normally slated for 5 doses, when they're drawn out and mixed, you can actually more often than not get 6 doses out of that vial. A similar situation, although less consistently, with Moderna, where the vial is supposed to be for 10, sometimes you can get an 11th dose out of that. So our vaccinators across the state are being educated on that and have been doing it. And I think in many cases, we are seeing more doses actually administered than are being counted for. And in fact, I think next week moving forward with the Pfizer doses, at least, those 6 doses will be counted in our doses administered, because that has been more consistent. Great.
There's a gentleman who has asked this question several times. It's for Dr. Gloria Ayensu. And I think we answered it, but perhaps we can reiterate the response. This gentleman did register for a vaccine. He is in the, at least in the 1B category, but he registered prior to January 18th. He did not receive a notification. Will he get some kind of subsequent notice now that you're attempting to talk to folks intermittently?
Yes, so he will not get anything. So the people who registered before January 18, up until now, have not received anything. But what we have said to them on our website is that we have your registration there. You're in the queue. When we do come up with our periodic system of notification, that's when this individual will get notification if he hasn't been served yet. Because prior to January 16th tells me that he's probably one of the, that's pretty early. So hopefully, we've been cranking it out about This week was a little bit different, but typically about 10,000 a week is what we had been doing. We actually had multiple additional vaccination clinics this week to draw down the vaccines that we had received. And so I am not sure. I'm not sure where where this individual is, and can't really say how far ahead he's moved, but 10,000 a week. And so January 18th, today is what, this is the end of the month. So in the last 2 weeks, we moved, I would say at a minimum, 20,000 people off of those rosters. And I know it's more because we had many more clinics this current week that we're in.
Okay, we've got 5 minutes, so I'm going to ask each panelist to make closing remarks before I go to our esteemed medical team here. I'm going to just note that folks, try to stay informed. Go to your government web pages, and they will all have links to the latest information on the COVID-19 vaccine effort. It's important to do due diligence and really keep up on the latest. And also, in the meanwhile, please wear your masks. You can still be a carrier of the COVID germ even after you're vaccinated. So continue to wear your masks and to do your social distancing and wash your hands frequently. Thank you for participating. And before we conclude, I will ask, her full name is Dr. Gloria Addo-Ayensu, and she is the director of the Fairfax County Health Department. Dr. Gloria, go ahead. And
Thank
then
you.
I'll conclude with Dr. Avula.
Thank you. I want to, I appreciate this time and the opportunity to speak to your viewers. I want to ask again for patience with us at the Health Department. We're doing the best that we can. We hear you. We appreciate hearing from you. So if you have any issues, please let us know. And as we just heard, as frustrating as it is to have to wait for vaccine, and especially in times of the news cycle where there is concern about limited vaccine supplies and so on, I don't want us to feel helpless, and to remember that prior to vaccines, there were effective public health measures that we've relied on all year long to bring us to this place. Those public health measures still work. And so I want to reiterate the mask wearing, the 6-foot social distancing, the staying home when sick, and the hand washing, critical measures that work. Thank you so much.
Thank you so much for joining us. Dr. Avula.
Thanks, Senator Favola. So I think I would just reiterate the need for understanding where we're at. We've got 105,000 doses coming into the state every week for the entire state. So just a few thousand for Fairfax County. And without a doubt, I mean, numerically and otherwise, Dr. Gloria and her team are leading the charge in terms of getting vaccine out and getting it out quickly. And I just want to assure you of that. She has been a friend and a mentor to me for the last decade, and there's no better health director in the state. So I want to affirm what your government is doing. I want to affirm the fact that we're all trying to get this out as quickly as possible, but there just isn't enough to meet the demand. And so we are going to have to know that this is going to be weeks and probably a couple months, especially when you're in those tiers at the bottom of 1B, and that we need to let those who really are at highest risk get to the front of the line. And so if you continue to have the ability to work from home and to minimize your contact, I know it's been a long 10 months, but we've got to let those who are at the highest risk get protected. And in the meantime, do all the things that we know work to stop transmission. And this will be behind us in a few months.
Yes, it will. What a wonderful, hopeful note. So thank you. And thank you all for listening and joining us. You can continue to contact your elected officials. And certainly Dr. Gloria Addo-Ayensu left her phone number and I put her email in the chat. We wish you all a safe and hopefully a relaxing weekend. Maybe the snow will be kind to us.
Thank you everyone for joining us, and thank you, Barbara, for Senator Favola for hosting this. And I know we all want to get back to normal, and the way to do that is listen to the doctors.
Famous last words. There you go. We've got it. Thank you, Delegate Murphy. Have a great weekend. Bye-bye.